Hi, I'm Jake, and I'm going to be doing my IV start video. I'm going to make sure to maintain medical asepsis, do my maintain GPSP, do my 11 rights, two patient verification, 3 med safety checks, and assess for allergies. So I'm going to go ahead and get my IV bag started or prepared. And I'm going to make sure to maintain medical asepsis throughout and not contaminate either the IV bag or the spike. So I'm going to go ahead and spike my bag. Okay, and this is my IV pole. Okay, and now I'm going to fill the chamber up halfway. Looks like one more behind, but it's okay. And then I'm going to go ahead and prep my line, my tubing. Again, making sure to maintain medical asepsis. Making sure there's no kinks or bubbles. Okay. Everything's good. Just gonna read. Oops. Again, making sure to maintain medical asepsis. I'm gonna reply for my cap. So everything's medical. Anyways, and now I'm gonna go ahead and set up my J loop and prime it as well. Okay, now that it's primed. And now I'm gonna get my stuff ready to set up my IV. So I got my tourniquet, my tape, and then I'm going to go ahead and Jay, can you help me with this real fast? So I'm going to make sure I assess my patient for allergies. I'm going to ask them which arm's more comfortable for them, and then depending on the arm or whatever, I'm going to assess the arm real fast and make sure there's no problems with it that would cause me not to be able to use it. Okay, use one of your arms. So I'm going to apply the tourniquet. This is just to show that a tourniquet part, I guess.
It's just a little bit difficult on those over there.
Yeah. So I'm going to check radial pulse. I'm going to palpate for a good vein, which I found one. Oh, sorry, I pulled the wrong one.
Okay.
Thank you. And for the rest of this, I'm just going to use this thing right here. It's just hard to do on that because it's so small. And then I'm going to go ahead and perform my hand hygiene and don my gloves. So I did remove the tourniquet earlier, just letting you know. I'm gonna go ahead and get my supplies ready. Let's see if I can find it. And now I'm going to reapply the tourniquet. I reapply it. Check radial pulse again. And then I'm going to clean my side. I'm going 3 to 4. The tourniquet gets 3 to 4 inches above the insertion site. So it'll be right here. Clean for about 60 seconds. I'm going to go ahead and get my IV. I'm going at a 10 to 15 degree angle, bevel up. Always making sure to maintain medical asepsis. Going in, okay, now I see a blood return. So now I'm going to advance the catheter, making sure not to touch the insertion site. I'm going to release the tourniquet. Keep pressure on the vein while removing my needle. I'm going to apply the safety. Okay. And now I'm going to stabilize the catheter hub, making sure not to touch the insertion site. Okay. I'm going to get my J-loop. Let's grab the hub. Load the air drive. Doing all this, making sure not to touch the insertion site. And now I'm going to begin with aspiration, check which we do have aspiration, and then I'm going to go ahead and flush it with the rest of this 10 milliliter saline, all while making sure that there's no complications with the site while doing so, which there isn't. Okay. And then I'm going to go ahead and remove the syringe. And I'm going to apply my Tegaderm. Making sure not to touch the side again. Oops, wrong side. Okay, well, I wouldn't do that. All making sure not to touch the side. It's a little bit hard to do on this thing. It's so small. And then I'm going to, I'll get stuff off my hand. I'm going to label it according to facility policy. And then I'm going to go ahead and go up to my thing. Now I'm going to grab it again. Oops, I wouldn't do that. And now I'm going to open this up, making sure to maintain medical asepsis. And then set it to the appropriate flow rate that's ordered. And then I'm going to assess the site, making sure there's no complications, which there isn't, no problems, no redness or anything. And then I'm going to remove my gloves and check with my patient to see if there's any new problems, which they have none over the procedure. I'm going to apply my hand, do my hand hygiene, and then I'm going to report and record, and then come back later to evaluate. Thank you.